Conférence de presse. I'm Elizabeth Thompson with CBC News. With us today, we have four ministers who will be discussing the Auditor General's report. The Honourable Jean-Yves Duclos, Minister of Health, le député Francis Drouin, secrétaire parlementaire du ministre de l'Agriculture, the Honourable Carla Qualtrough, who is Minister of Employment, Workforce Development and Disability Inclusion, and the Honourable Mary Ng, Minister of International Trade, Export Promotion, Small Business and Economic Development. We'll start with statements, then we will be going to questions in the room at the microphones, and then after that we will go to questions on the phones. Minister Qualtrough.
Thank you. Hello, bonjour tout le monde. I'd like to acknowledge that we are joining you today from the unceded traditional territory of the Algonquin and Anishinaabe people. I'm here obviously to speak about the temporary foreign worker audit. I want to begin by making it very clear that the health and safety of temporary foreign workers is of the utmost importance to me, my colleagues, ESDC officials, and the Government of Canada. Like every worker in Canada, they deserve to be safe in their workplaces. And recognizing the particular vulnerabilities associated with being a temporary foreign worker, it's doubly important that our programs and policies ensure the safety and security of these vital workers. Dès le début de la pandémie, le gouvernement du Canada a reconnu le rôle important que jouent les travailleurs étrangers temporaires dans notre sécurité alimentaire nationale et chaque décision que nous avons prise a fait en sorte que la santé et la sécurité de ces travailleurs et des Canadiens demeurent une priorité. As the pandemic hit, thousands of temporary foreign workers were scheduled to arrive in Canada. We immediately strengthened conditions for the program and brought in even stronger penalties for employers who failed to comply. We put in place a quarantine process and a new virtual inspection regime. Throughout the 2020 and 2021 seasons, we hired more inspectors, put in place a tip line, invested in migrant worker associations, and worked closely with partners at home and abroad. The Auditor General's report clearly outlines that despite our efforts, we fell short. We know that more must be done as we begin preparations for the upcoming agricultural season. And at the same time, the pandemic has further highlighted the systemic challenges and inherent inequities that exist within the temporary foreign worker program. This also needs to be addressed, and that work is ongoing. We are rebuilding the TFW program's compliance regime. The Auditor General's recommendations, which we accept, will guide this work. Steps have already been taken to improve the quality and timeliness of our inspections, reduce the backlog, increase resources, and better support our inspection staff. We are also working with provinces and territories on minimum national accommodation standards. While these improvements are important, we know that more work needs to be done. Comme je l'ai souligné dans la déclaration que j'ai rendue publique plus tôt aujourd'hui, j'ai fourni à mon sous-ministre des objectifs clairs et lui ai demandé des progrès tangibles d'ici mars 2022, le début de la nouvelle saison. As we've done throughout the pandemic, I'll be working closely with provinces, territories, partner countries, and migrant worker organizations to ensure this work remains on track. Never have our intergovernmental and stakeholder relationships been stronger or more important than right now. We've all had to step up through this pandemic and reach across jurisdictions to solve really complex problems. That's why I have full confidence that we can and will rebuild the temporary foreign worker program. And while we recognize that the vast majorities of employers made sincere efforts to work with the Government of Canada during the pandemic in order to ensure temporary foreign workers were safe, rest assured that we will do better to ensure that bad actors are punished and that temporary foreign workers have safe and healthy workplaces. Merci. Je cède maintenant la parole à mon collègue, le secrétaire parlementaire Francis Drouin.
Merci beaucoup. Bonjour à tous. Je suis heureux de me joindre à mes collègues au nom de la ministre Bibeau pour répondre à vos questions concernant le rapport de la vérificatrice générale sur la protection du système alimentaire canadien. Mon nom est Francis Drouin. Je suis secrétaire parlementaire de l'honorable Marie-Claude Bibeau, ministre de l'Agriculture et de l'Agroalimentaire. Minister Bibeau wishes she could be here. However, she is on her way to meet with farmers in British Columbia who were affected by the floods. On her behalf, I would like to say we recognize the importance of the findings and accept the recommendations of the report. We fully agree with the report's call for a national emergency preparedness and response plan for a crisis affecting Canada's entire food system. Taking into consideration the food security of Canadians, we're continuing to improve our coordination processes, and the BC flood situation has provided another opportunity for continued improvement. We know that our strength is in ensuring a streamlined and coordinated response. We also recognize the report's recommendation for greater fairness and transparency in program input and design, as well as the importance of improving oversight controls and the development of performance measurements. Il est essentiel que les programmes tiennent compte de la diversité de la population canadienne à des réalités sociales, économiques et environnementales. Nous sommes également déterminés à améliorer notre façon de mener l'analyse comparative entre les sexes, et de mesurer les objectifs de développement durable dans toutes nos initiatives futures. Ce sont tous là de précieux conseils. En répondant à chaque recommandation, nous contribuons à garantir un accès fiable à des aliments abordables, salubres et nutritifs à tous les Canadiens et Canadiennes d'un océan à l'autre. Merci beaucoup. La parole est à vous, M. Duclos.
Merci, chers collègues, et bonjour tout le monde, et merci d'être là aujourd'hui. I am here today in response to the Office of the Auditor General of Canada's performance audit of the Public Health Agency of Canada's enforcement of mandatory quarantine and testing measures for travelers to limit the spread of COVID-19 in Canada. Let me begin by thanking the Auditor General for the report, which looks at the efforts of the agency from July the 1st, 2020 to June 30th, 2021. Let me also say that there is a lot we have learned about border measures in the context of this once-in-a-century pandemic. Je m'adresse aujourd'hui en guise de réponse à l'audit de performance du Bureau du vérificateur général du Canada sur la mise en œuvre par l'Agence de la santé publique du Canada de mesures de quarantaine et de dépistage obligatoires pour les voyageurs dans le but de limiter la transmission de la COVID-19 au pays. Je tiens tout d'abord à remercier la vérificatrice générale pour le rapport qu'elle a fait, qui examine les efforts de l'Agence du 1er juillet 2020 au 30 juin 2021. Je peux vous confirmer que nous en avons appris davantage sur les mesures aux frontières grâce à ce rapport dans le contexte d'une pandémie centenaire. Comme la vérificatrice générale l'a remarqué, l'intervention du gouvernement n'a certainement pas été parfaite. As the Auditor General has noted, the government's response has been far from perfect. We acknowledge this and we are making no excuses for it. We can and we must do better. Nous reconnaissons que nombreux défis subsistent et que nous ne cherchons pas d'excuses. Nous pouvons et nous devons faire mieux. This report also acknowledges that the Public Health Agency of Canada has taken important steps to improve the enforcement of quarantine requirements and their verification of travelers' compliance, which are essential elements of the layered approach to border measures. I believe that facts tell an important story, so please let me lay out some of the critical facts. Since the beginning of the border measures, we have made more than 7 million compliance verification calls and completed more than 500,000 visits to returning travelers to confirm that they were quarantining at home. As a result of these activities, over 90% of travelers required to quarantine fulfilled their obligations. In addition, more than 7,000 enforcement actions have been taken. More than 15,000 individuals stayed at a designated quarantine facility managed by the federal government. And we completed more than 2.8 million post-arrival tests to limit the importation and spread of COVID-19 and its variants of concern. Merci de me permettre de répéter ceci en français. Depuis le début de la mise en œuvre des mesures aux frontières, nous avons effectué plus de 7 millions d'appels portant sur la conformité et confirmé la quarantaine à domicile pour plus de 500 000 voyageurs par l'entremise de visites sur place. Grâce à ces activités, l'Agence a pu valider que 90% des voyageurs contactés qui devaient se mettre en quarantaine ont rempli leurs obligations. En outre, plus de 7 000 recours en matière d'application de loi furent posés. Plus de 15 000 personnes ont séjourné dans des installations de quarantaine désignées, gérées par le gouvernement canadien, et nous avons effectué plus de 2,8 millions de tests de dépistage après l'arrivée des voyageurs pour limiter l'importation et la transmission de la COVID-19 et de ses variants préoccupants. Compliance and enforcement of border measures is something we take very seriously. As noted by the Auditor General herself, there have been significant improvements since the Auditor General's first report. Whereas the Public Health Agency was unable to confirm whether travelers were observing quarantine obligations in 66% of cases in her first report, the Auditor General finds this was true in 37% of cases as of June 2021. That is still too much, way too much, but it also demonstrates a significant improvement. It's also worth noting that this report only covers the period starting from January 2021 to June 2021. Since then, the Public Health Agency has taken a series of different steps to address the challenges and gaps the Auditor General has identified. For example, just last August, the agency has awarded more than $27 million in contracts to 4 private security firms to increase its number of agents physically following up with travelers required to quarantine. Par exemple, l'Agence de la santé publique du pays a accordé des contrats d'une valeur d'un peu plus de 27 millions de dollars à 4 firmes de sécurité privées afin d'augmenter le nombre d'agents qui peuvent se rendre physiquement au domicile des voyageurs et vérifier que ceux-ci respectent bel et bien leurs obligations de quarantaine. The use of the ArriveCan application by travelers has also significantly increased since July 2021 to now 90% of travelers, which allows the agency to rely on much more accurate data when following up with travelers to enforce quarantine and testing measures. Additional steps are being taken to ensure that we keep doing better. I have directed officials in my department, including the Chief Data Officer of the Public Health Agency of Canada, to come up rapidly with a plan to optimize the collection and sharing of travelers' information in order to ensure better follow-up and better enforcement of border measures in the immediate future. We also want to make sure that our provincial, territorial, and municipal partners are well aware of their legal authority when it comes to enforcing the Quarantine Act. À l'heure actuelle, la Colombie-Britannique, le Manitoba, l'Ontario, le Québec, le Nouveau-Brunswick, la Nouvelle-Écosse, l'île du Prince-Édouard et Terre-Neuve ont un accord avec le fédéral qui permet aux forces policières locales d'émettre des contraventions et de sévir envers les gens qui contreviennent à la loi sur la quarantaine. Dans les provinces et les territoires qui ne détiennent toujours pas d'entente avec le gouvernement fédéral à ce sujet, nous allons nous assurer que les suivis soient faits avec nos agents. I want to be very clear with Canadians. We have accepted all the recommendations of the Auditor General because we agree that we need to be constantly vigilant in our approach to border measures. One of the key lessons we have learned is that we have to respond quickly as new information becomes available. We have seen this most recently in the border measures we have introduced to reduce the risk of importation and transmission of the Omicron variant of concern. Because of the uncertainty surrounding this variant, in a matter of days, the Public Health Agency of Canada implemented enhanced border measures, including stringent quarantine and enhanced testing requirements for travelers. To Canadian travelers, I say this: plan ahead, be prepared for airport delays, have a quarantine plan, use the ArriveCan application or website to submit your information, and be prepared for authorities to follow up with you to make sure your testing is complete. Aux voyageurs canadiens, je vous dis, planifiez. Préparez-vous à des retards possibles aux aéroports. Faites votre plan de quarantaine, utilisez l'application ArriveCan sur le web ou sur le téléphone pour transmettre vos données et attendez-vous à des suivis de la part des représentants du gouvernement canadien qui s'assureront avec vous que vous faites tous et toutes vos tests de dépistage. Merci, and I will now turn the microphone over to Minister Mary Ng.
Thank you very much, Minister Duclos. Let me begin by acknowledging that I am joining you from the traditional territory and unceded territory of the Algonquin and Anishinaabe people. And for those of us who are settlers or even immigrants to Canada, it's important to recognize that Indigenous peoples have always been here and that Canadians have a role to play in reconciliation. I want to begin by thanking the Auditor General and her office for their important work, and I'm pleased to speak on the Regional Relief and Recovery Fund. I want to start by thanking the regional development agencies and all of the public servants that worked tirelessly to help deliver these emergency supports. It was at the very beginning of the pandemic that our government announced the Regional Relief and Recovery Fund. We did not have a vaccine. COVID-19 was spreading fast. Businesses had listened to public health direction. They shut their doors, and there was a lot of uncertainty for people and for our businesses. Our government's $2 billion investment in the RRF was a key part of how we supported businesses through this crisis, especially those that needed additional help or that did not qualify for other measures. For some businesses, this was the only support program available to them. This fund complemented our other support programs and made sure that no businesses fell through the cracks. At the very rapid delivery of this program meant that over 100,000 Canadian jobs were protected, and close to 25,000 businesses and organizations were able to keep their doors open, keep their employees on the payroll, and prepare for recovery. There are tens of thousands of businesses today that are open as a result of this program. This report confirms that the RRF succeeded in delivering timely support to thousands of businesses, organizations, and workers across the country when they needed it the most. Our government is committed to continuously working to improve programs and services that we deliver to Canadians. The findings of the audit will help strengthen our ability to continue supporting Canadian businesses and workers as we all work to finish the fight against COVID-19 for good. Thank you so very much, and now we will open it up to questions.
Now I'll open it up for questions. At the microphone, please identify yourself with your name and your media outlet. And even though, Raymond, I know you very well. First question.
Thank you. Merci. Bonjour, M. Duclos, Raymond Filion de TVA. Évidemment, c'est un rapport de la vérificatrice qui tombe quelques jours après que vous ayez annoncé de nouvelles mesures pour contrer le variant Omicron. Or, Mme Hogan nous a dit plus tôt aujourd'hui que le fédéral n'est pas prêt, n'a pas les moyens de ses ambitions pour contrôler les voyageurs comme vous avez annoncé. Qu'est-ce que vous répondez à ça?
Bien, je peux dire que c'est un rapport qui, effectivement, dit que nous n'avions pas les moyens de nos ambitions jusqu'en juin 2021. Heureusement, malheureusement, évidemment, le rapport est très critique et Mme Hogan a tout à fait raison de l'être. Si je peux ouvrir une parenthèse brièvement, nous avons la chance au Canada et dans toutes les provinces et les territoires d'avoir des mécanismes de redevabilité de cette valeur et de cette importance qui amènent les gouvernements à devoir et à vouloir faire mieux. Donc, jusqu'en juin 2021, on voit dans le rapport qu'effectivement, il y avait encore des failles importantes dans la cueillette et le partage et l'utilisation des données. Ceci étant dit, les choses ont continué à s'améliorer depuis juillet 2021. Et une des choses qui s'est améliorée, c'est l'adhésion beaucoup plus importante à Arrive-Can. On est rendu à 92 % d'adhésion. Évidemment, quand on travaille avec des formulaires papier, avec les gens griffonnent leur numéro de téléphone ou leur adresse courriel, bien, on n'est pas surpris qu'on peut avoir de la difficulté à les contacter par la suite. Donc, ce sont des méthodes qui peuvent être valides à court terme, mais c'est sûr qu'il fallait aller beaucoup plus vite. Et ça aurait pu aller plus vite, je crois, avec les informations dont je dispose dans le rapport. Maintenant, on est en décembre 2021 et on dispose d'outils différents pour faire face à la nouvelle menace, qui est la menace du variant Omicron.
Donc, les choses ont changé et là, vous assurez les Canadiens que pour Omicron, le dépistage sera hors pair?
Non, parce qu'évidemment, on a le choix de faire deux choses. La première, c'est de ne rien faire. Et la deuxième, c'est de faire des choses imparfaites. Et un gouvernement qui se limite à faire des choses parfaites est un gouvernement qui ne fera jamais rien. Alors, peu importe les efforts que l'Agence pourra faire au cours des prochains jours et des prochaines semaines, peu importe les efforts déjà faits depuis janvier 2021, il va toujours rester des gens que l'on ne pourra pas retracer pour toutes sortes de raisons, qui auront quitté le pays ou dont les informations de contact n'auront pas été données correctement. Donc, il y aura toujours des failles dans un système de cette importance, mais l'important, c'est de mettre en place le meilleur système possible. Et ce que je dis, c'est que le système que l'on a maintenant est meilleur que celui qu'on avait certainement au début de la pandémie et mieux encore que celui qu'on avait jusqu'en juin 2021.
La presse canadienne.
Merci beaucoup. Bonjour encore pour vous, Monsieur Duclos. Je vous écoutais tout à l'heure. Vous dites, nous ne cherchons pas d'excuses, nous pouvons et nous devons faire mieux. Vous semblez déjà avoir donné des directives à l'Agence de la santé publique pour régler certains des problèmes notés par la vérificatrice générale. Pourquoi est-ce que votre prédécesseur, Patty Haidou, n'a pas fait tous ces changements-là?
Bien, Madame Haidou, écoutez, tout le gouvernement, j'en faisais partie aussi, évidemment, a travaillé et nous avons travaillé dans un contexte d'extrême urgence. Ce que l'on constate clairement, c'est que l'Agence de la santé publique n'avait pas les outils de collecte, d'entreposage et de partage d'informations à un niveau de ce que la pandémie exigeait. L'Agence de la santé publique était une agence de recherche, une agence qui surveillait à un niveau plus macro, plus communautaire, l'évolution possible, éventuelle de pandémie, n'avait pas les informations, n'avait pas les outils au départ technologiques pour faire face à une crise qui demandait des outils, des informations détaillées par individu reliées au parcours, au voyage de ces gens, maintenant reliés au statut vaccinal, au contact que les gens ont pu avoir. Donc, c'est une opération de micro-données considérable pour laquelle l'agence n'était pas préparée certainement au début de la pandémie. Et encore maintenant, elle n'est pas encore tout à fait prête à le faire parfaitement.
OK, mais vous semblez dire qu'elle le sera bientôt. J'avais aussi une autre question. Je voulais revenir sur la récolte des données parce que vous l'avez bien mentionné, certaines provinces, en fait, ne sont pas obligées de dire combien de contraventions elles ont données aux voyageurs. Dans le cas du Québec, c'est particulier parce que les procureurs provinciaux ne sont pas obligés de donner le nombre de contraventions. Donc là, bref, on avait le chiffre 0 dans le rapport de la vérificatrice générale. Comment est-ce que vous allez faire justement pour tenter d'obtenir ces chiffres-là de Québec?
Bon, il y a trois choses là-dessus. La première, c'est qu'il y a effectivement certaines provinces qui n'ont toujours pas d'entente avec le gouvernement canadien pour l'émission de constats d'infraction. Et ça, c'est un gros problème. Et je vais travailler rapidement avec mes collègues de la justice et des affaires intergouvernementales pour voir comment on peut résoudre ça. Parce que c'est non seulement un problème pour dans les questions d'infraction aux quarantaines et aux tests, mais c'est aussi un problème plus général lorsqu'on a besoin d'utiliser, et des fois, non seulement on a besoin, mais c'est la seule façon de le faire, d'utiliser les forces policières locales pour faire le suivi d'infractions de nature plus fédérale. La deuxième chose, c'est que les provinces qui ont déjà des ententes les utilisent de différentes manières. Et au Québec, le DPCP fait un travail que l'on pense être rigoureux depuis déjà un bon nombre de mois avec le gouvernement canadien. Ça a commencé au début de 2021. À l'époque, un petit peu avant 2021, il y avait, j'appellerais ça une certaine inertie, là, un manque de partage d'informations entre le gouvernement canadien et le gouvernement du Québec qui avait généré certaines frictions à l'échelle administrative. Ça a été réglé. Et maintenant, depuis donc presque un an, le gouvernement canadien et le gouvernement du Québec travaillent très bien ensemble pour le partage d'informations qui peuvent mener à des constats d'infraction livrés par le DPCP au gouvernement du Québec. Dans d'autres provinces, ça fonctionne un petit peu différemment. En Ontario, c'est un mécanisme qui est assez efficace quand même, mais qui n'est pas tout à fait le même là, que celui qu'on voit au Québec. La dernière chose, c'est qu'il y a un enjeu, effectivement, de partage d'informations. Et pour certaines provinces, dont le Québec, eh bien, on n'a pas ici, au gouvernement canadien, d'informations sur le suivi qui a été apporté au transfert d'informations au niveau des infractions. Donc, on fait confiance au gouvernement du Québec. On suppose et on croit que le suivi est fait correctement par le DPCP, mais le relais de ces informations sur le suivi n'est pas fait pour l'instant.
À droite, Louis Blouin.
Bonjour, M. Duclos. La vérificatrice générale dit que l'Agence de la santé publique n'avait pas les ressources pour bien faire son travail. On regarde actuellement ce qui se passe dans les aéroports. Le niveau de dépistage n'est toujours pas aux cibles escomptées. Ma question, allez-vous augmenter les ressources de l'Agence de la santé publique pour qu'elle puisse faire son travail?
Très bonne question. Et je vais vous dire déjà que demain, on va faire le point là-dessus. J'ai reçu là, dernièrement les informations que j'attendais sur l'augmentation attendue et substantielle des capacités de dépistage aux aéroports, y compris à l'aéroport de Montréal. Et donc, j'ai hâte de faire le point demain avec vous sur cet enjeu là, qui touche au variant Omicron.
Mais sur l'augmentation des ressources, précisément, c'était ça ma question. Allez-vous augmenter les ressources?
Évidemment, avec l'augmentation nécessaire et substantielle qu'on doit faire au niveau des dépistages dans les différents aéroports, lorsqu'on parle de tester tous les voyageurs qui viennent d'autres pays que des États-Unis, l'agence a besoin d'avoir des ressources substantielles. Mais vous allez voir demain là, que beaucoup de ces ressources viennent de contrats importants là, qui ont été accordés au cours des derniers jours, qui vont permettre à l'agence de compléter ses propres ressources pour faire le travail dans les prochaines semaines.
Deuxième question pour la ministre Qualtrough. Comment on a pu penser que c'était une bonne idée de confier aux employeurs le soin de fournir des photos au gouvernement pour les travailleurs étrangers des installations? Comment on a pu juger que c'était une bonne idée de penser que les employeurs seraient les bonnes personnes pour déterminer s'il y avait des bonnes conditions de vie pour les travailleurs étrangers? Est-ce que vous regrettez d'avoir fait cette approche-là?
C'est une bonne question. Et, quand on était au début de la pandémie, on ne pouvait pas aller en personne pour faire les inspections. Alors, on a créé un système d'inspection virtuelle qui a requis que les employeurs prennent les photos, font le tour et que les inspecteurs regardent ce que les employeurs font. On a créé plus d'obligations, des obligations plus hautes qu'avant la pandémie. Avant la pandémie, c'était les officiels locaux et provinciaux et territoriaux qui ont fait les inspections de la santé publique, mais avec la quarantaine et la pandémie, on a choisi de prendre ce job parce qu'on était très conscients des conséquences de la pandémie et de l'infection. Alors, avec la situation et les restrictions de santé publique, on était dans une situation virtuelle et at the time, we did the best we could to engage employers to help us do this work.
Ça va changer?
Ça a changé. Excuse-moi, j'ai oublié. Maintenant, on retourne les inspections en personne. Alors, c'est nos officiels qui prennent les photos, qui font les investigations. Ça a changé.
Okay, Mike to my left.
Hi, Chris Logue with Global News. My questions are both for Minister Duclos. So the Auditor General said that PHAC did not contact 14% of travelers who tested positive for COVID-19. What's your response to that, and can you commit that 100% of those who test positive going forward will be contacted?
Well, I can commit certainly that it will be fewer than 14%. As I mentioned in French briefly, the agency now has access to better and more reliable data, in particular through ArriveCan. We are not only pleased, but we need the fact that the vast majority of Canadians, 92% of them that travel into Canada, are now using ArriveCan with information that can easily stored and used for follow-up purposes, as opposed to using paper-based forms, which obviously can get lost and can be quite imprecise. Now, whether we will reach 100%, no. That will never reach 100% of people being contacted for any particular reason, because such a system doesn't exist. However, a good and improving system is better than no system at all. And that's why we'll continue to do what we need to do, which is to put into place those measures to protect Canadians in the context of the Omicron variant.
And my next question is on rapid testing. So can you update us on what the conversations are in terms of rapid testing with the provinces on giving them more, and if you think Canadians should have fair and free access to those tests?
That's a very good question too. Two dates, yesterday and tomorrow. I had a meeting with my provincial counterparts yesterday, and a good part of that meeting was on rapid tests and how we can make better and increased use of them. And tomorrow I look forward to report on those conversations. I have to come back to some of my colleagues later today to make sure that they have the information and validate that before we make it public.
Are you pushing for them to be handed out free?
Yes, it will always be free. The federal government has paid for vaccines, has paid for PPE, has paid for the vast majority of testing rapid tests and PCR tests, certainly at the borders. And we're paying for therapeutics as well, and therefore we'll continue to do so because this is absolutely essential. Well, obviously we can't decide what provinces will do with those tests, but the federal government is sending those tests for free.
Mike to my right.
PHAC has indicated that it has now instituted automated processes for monitoring check-in information for quarantine hotels, but the auditor didn't note an improvement when that new process was introduced. Is that automated process being used now for travelers returning from the 10 African countries? And are you confident you're now able to track every check-in? I know there's a bit of overlap there. By the way, Erica Ibrahim, the Canadian Press. Sorry.
Thank you. Well, yes, a lot of automation has been performed, in part, as I mentioned earlier, because we have ArriveCAN used by 92% of the people. But that ArriveCAN is an electronic system, which we can clearly link with what is called the QCMS. It's a jargon. It's a management system for quarantine control operations. So the two systems speak together. So when people come in, we know from a health perspective who they are, whether they were vaccinated, where they traveled from, and all sorts of other information which we can use to apply the right testing protocol to them. And then once that is done, we send them home with a home test, or they are being tested on site at the airport, and then we know when that is done, we know the test result, when it's being sent back to PHAC. And all of this is possible now because we have a digital and therefore more automatic system. Now, whether this is going to be perfect, no, there's never going to be perfection in such big systems.
And my next question is for Minister Qualtrough. ESDC promised to address these inspection issues when the auditor raised them with senior officials in December and February, but the situation got worse. Why should anyone believe they'll be fixed now?
A good and fair question. And what I can say is the Auditor General focused very specifically on the inspection regime. And we put in place a whole bunch of heightened obligations on employers, protections for workers, requirements around quarantine. After the Auditor General raised these concerns late last year, earlier this year, we redesigned our tip line. We introduced more measures to strengthen our inspection. In Budget 2021, we funded migrant worker support organizations to reach out to workers, to advise them of their rights, to help them understand how to access information and access the tip line if they were experiencing distress within their employer. And within ESDC, we improved our strategies to address workload and to better support our inspection staff, I guess what I would say. That's taken some time. Since then, since the end of the audit, we've seen some improvement. I, too, like Mr. Duclos, have given some very specific deliverables to my deputy minister around what I expect to see when it comes to supplemental training for staff, a process to be put in place if a worker signals that they are in distress or danger, with respect to closing out files, having a standard that by March 80% of them will be full and complete, and by September 90% of them. So we've got some very specific deliverables that I expect to be met.
Okay. Marie-Vestel Le Devoir.
Bonjour, Madame Qualtrough. Je voulais revenir sur ce que vous répondiez à mon collègue Louis sur ce qui a changé depuis le rapport de la VG pour les travailleurs étrangers temporaires. D'abord, vous dites que les inspections sont plus en virtuel. Est-ce que c'est 100% des inspections qui ont repris en personne? Qu'est-ce que vous faites pour les arriérer, le backlog, le fait que vous avez pris du retard? Et est-ce que vous augmentez encore plus le nombre de staff qui va contribuer à rester à jour dans les inspections?
C'est de bonnes questions. On a plus que doublé le nombre d'inspecteurs qui font les inspections pour les travailleurs, pour les... I'm sorry, we've more than doubled the inspection staff, and we are continuing to add more staff regularly. Importantly, we are training our staff to do quarantine inspections because, of course, we still have temporary foreign workers coming in, some of whom aren't vaccinated and must still quarantine. We are confident that the measures we've put in place will result in a more robust record of inspection. I think that's probably how I would say it best. But we're doing our absolute best, having heard very clearly from the Auditor General at the beginning of this year and having heard today from the Auditor General that there's much more work to be done and that we did fall short in our inspections. We though are confident that we can do much and must do better.
Just on the virtual, are they 100%?
I'm sorry, I didn't answer that. Not 100%, no. Part of that option existed prior to the pandemic, but was not very utilized very often. I don't have that number for you, I apologize, but no, we're not back at 100%.
But are you like 50, 80?
I'm sorry, I don't have that number, but the majority, I would say, but I don't want to be inaccurate. I can get you that information.
Fair enough.
Yep.
Monsieur Duclos, sur la frontière, maintenant, vous dites que vous auriez pu aller plus vite, que c'est parce que l'Agence de la santé publique n'avait pas ArriveCan au départ que ça ne roulait pas rondement. Mais en même temps, n'était-ce pas la responsabilité de votre gouvernement d'avoir équipé l'Agence de la santé publique dès le départ? Ça fait 2 rapports que la vérificatrice générale émet pour dire qu'on ne surveille pas adéquatement les quarantaines, les tests, on ne sait pas qui a testé positif. Qu'est-ce que vous pouvez dire maintenant pour convaincre les Canadiens que ce qui se passe à la frontière, ça arrive? Au-delà de dire on n'avait pas ArriveCan, n'est-ce pas la responsabilité de votre gouvernement d'avoir échoué au départ puis d'avoir mis presque 2 ans pour trouver comment faire?
Bien, je pense qu'on a raison et on doit toujours mettre la pression pour les gouvernements de toujours faire mieux. Et dans ce contexte-ci, je crois que les choses auraient pu être mieux ou encore mieux. Il y a 2 défis. La première, c'est que l'Agence de la santé publique devait mettre en place rapidement des mesures particulièrement exigeantes pour protéger la santé des gens et, parallèlement à ça, mettre en place de l'infrastructure technologique informationnelle pour pouvoir traiter des cas de millions de Canadiens qui voyageaient à travers la frontière. Et quoique l'Agence de la santé publique a quand même eu un assez bon succès lorsqu'il est venu le temps de fournir des équipements de protection individuelle, des tests moléculaires au début, des tests rapides par la suite, des vaccins parmi les premiers pays dans le monde. Là-dessus, je pense que l'Agence a très bien performé, certainement par rapport à d'autres pays ailleurs. Sur le plan de la préparation digitale et numérique, l'Agence n'était pas prête, n'avait pas les capacités de faire ça rapidement. Pas comme, par exemple, Statistique Canada aurait pu le faire. Alors, c'est un constat. Ce n'est pas un jugement, c'est un constat. Et comme vous l'avez dit, heureusement, depuis à peu près 1 an, un petit peu moins qu'1 an, les processus numériques se sont beaucoup développés. Ça a eu un impact sur le taux qu'on a vu de 65 à 55 à 37 vers la fin du printemps 2021. Et maintenant, bien là, on est arrivé à 92 d'ArriveCan et par conséquent, les informations numériques sont beaucoup plus abondantes et beaucoup plus fiables surtout.
Thank you. We will now go to the phones. On va passer au téléphone. It will be 1 question, 1 follow-up. And if we can give precedence to the members of the parliamentary press gallery. Operator?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, Marieke Walsh from the Globe and Mail. Your line is open. Please go ahead.
Good afternoon, ministers. My question is for Minister Duclos. The Auditor General says that PHAC could only verify 25% of the 370,000 people who were supposed to go to government-authorized hotels for their quarantine actually showed up. So does that mean that somewhere in PHAC's records, there's 270,000 people who did not show up, or is it just that PHAC cannot prove that they showed up? Do we actually know what happened to those people?
Yes, and I'll give you two reasons for that. The 75% percentage that you quote, that's a percentage of cases for which PHAC doesn't have complete information. Now, PHAC, the second thing is that PHAC obviously focused on ensuring that people actually went to the hotel, and when it was suspected that those individuals didn't go to a hotel, they were being identified, signaled, and followed up. However, it is true that in the vast number of cases, 75% of the cases, complete information on how long these people really stayed at the hotel as opposed to whether the people went to the hotel. That information is incomplete.
Okay. I'm clear. So you're saying that you have data that shows more people showed up, but it's not clear how long they stayed. And then my second question is that the Auditor General made it very clear that at this point, PHAC cannot prove, and the government cannot prove, that the rules you've enforced and brought in actually have any impact on the spread of COVID-19 in Canada. Do you have any hard evidence to show us that these measures are actually doing anything?
Well, this is evidence gathered from across the world and evidence gathered across time. So from the start, we've known that contact tracing, isolation, testing, obviously, that is key in order to fight a pandemic until we get access to a vaccine. So we knew that from a public health perspective. Now, exactly by how many deaths we have been able to avoid because of all those measures, that's difficult to do because it's a combination of all of these measures together that make fewer people sick and fewer people die. So what eventually I believe researchers will be able to do that, possibly from a comparative perspective. For instance, in Canada, different measures were adopted at different speeds across the different provinces. So I've been a researcher for most of my life before 2015. So I have an idea of the type of techniques that public health researchers and health economists will be able to use to identify more precisely which measure led to which outcome. But it's a combination of those. Again, you can assess that from an intra-Canada perspective. You can also compare across countries. By the way, looking at the south of our borders, you can easily see that the death rate has been significantly larger there. 3 times larger. The death rate in the U.S. is 3 times larger than that of Canada. So 3 times more deaths in the U.S. would mean that we would have had 60,000 more deaths in Canada had we followed the same epidemiological evolution of the United States. So one day researchers will be able to say, well, this is a reason for which we have had many more deaths in the United States than in Canada. Is it because of, as I said, better public measures, people following those measures more closely? Is it because of the fact that PPE was more easily available, and so on? So I couldn't tell you at this particular moment, but that's certainly a very important question.
Operator, next question. Prochaine question.
Thank you. Merci. Our next question, la prochaine question, Wyatt Sharp, The Wyatt Sharp Show. Your line is open. À vous la parole.
I'm just going to ask, obviously many headlines as well as the report today indicated that the government wasn't fully able to protect foreign workers from COVID-19. It's been mentioned briefly by some of you. So maybe if you can speak a little bit about, obviously these people are coming to Canada, they're getting an occupation for themselves, but they're also largely contributing to Canada's economy and they're making a difference on our economy. So what further measures can be taken to make sure that, these people are getting the same protections from COVID as any other Canadian citizen would?
Well, thank you for that really important question. I can assure you, as I said in my remarks, that we have been making Herculean efforts since the beginning to protect the health and safety of temporary foreign workers. We understand the important role they play in our food security, and we also understand what they're doing for Canadians by putting food on our tables. We have made some progress. We've put in place a number of measures. There's more to be done, and when you ask what can be done, I would follow the direction I've given to my deputy minister around better training and supporting our inspection staff, working more closely with employers and migrant worker organizations to ensure both that employers know their obligations, but that workers know their rights, working with the Minister of Immigration on an open work permit, which we have put in place in the past year, so that if workers are in a situation that is dangerous or unhealthy, it's a really imbalance of power that exists sometimes in these relationships. And maybe like Jean-Yves, I'll draw on my experience as a human rights lawyer, but it has always concerned me that we need to do a lot as a federal government to balance that as much as we possibly can. So this is about, when we welcome workers in the next few months, that we work with provinces and territories and employer organizations to get people vaccinated, that we make sure that our inspections are better this season so that we know and we can document and reassure Canadians that workers are living in acceptable conditions. There's a whole bunch of things that we can do. I've got a long list. I'm happy to go over it again and again, but certainly lessons learned from the past 2 seasons will be applied for this season coming up.
Okay, and as a follow-up, you mentioned about some of the, obviously vaccinations. That's obviously, according to public health experts, the best way to end this pandemic. So maybe you want to talk a little bit about the idea of access to vaccines for these people, because obviously some of them are coming from more vulnerable groups, some of them from more vulnerable countries of COVID. So maybe just speak a little bit about how important vaccination will be in order to protect people and what the access to vaccination is like for these people.
Again, really important question and an example of how closely we're working with both source countries and the countries from which temporary foreign workers come and the provinces and territories. So a decision was made to exempt temporary foreign workers from the requirement, as they are essential, to be vaccinated upon arrival in Canada. We have worker and employer organizations that are working closely with provinces and territories to vaccinate their temporary foreign workers as they come to Canada. We hope and we encourage and we share the belief, as do our provincial counterparts, that is the way forward within this pandemic, particularly for temporary foreign workers. We understand that they're coming from countries where either they don't have access to vaccines, certainly not a second one in many cases, or they have received a vaccine that isn't approved in Canada. So we're always trying to balance the need to bring people to Canada to perform this essential service with the need to protect them, their Canadian co-workers and employers, but to keep this food system going in our country, vaccines is definitely the top solution in my mind.
Operator, next question. Prochaine question.
Thank you. Merci. Our next question, la prochaine question. Kevin Gallagher, CTV National News. Your line is open. À vous la parole.
Hi, my question is for Minister Duclos. I'd like to follow up on, I'm not quite clear on your answer for what's changed in terms of the Auditor General's report when they're looking at people who are supposed to have stayed in quarantine hotels, and it says because of gaps and duplications in the way that information was collected, the agency, the Public Health Agency of Canada, had records that verify only 25% of air travelers were able to stay in hotels from February to June 2021, and they couldn't verify, 3/4. So the rest of them, that's about 277,000 people that they can't verify. I didn't really understand your answer last time. So has something changed? Is there something new in terms of the organization of the data? It's recommended here that there needs to be some sort of automated system. Has that changed? I was really unclear in your last answer. Perhaps you could let me know. Does the Public Health Agency have a firmer grasp on keeping track of who is and is not staying at required quarantine hotels?
Thank you. Well, the first thing is that these government-authorized accommodations don't exist. They have stopped being used in August 2021. Now, until they ended, they were, as I said, completely monitored by PHAC. PHAC knew in most cases whether people had gone to those hotels, but didn't know the complete stay, and that's true. 75% of the cases had incomplete information. So that's troublesome, obviously. What happened towards the end of the report, towards the end of the period for which the Auditor General wrote her report, around the end of May, June 2021, is that there was at that time, but then an automation system, which there wasn't in the early part of 2021. So to be more clear, perhaps before, between January 2021 and the end of May 2021, everything was either paper-based or through emails or text messages, so extremely difficult to to make efficient use of. It's only in June that a truly automated and reliable system was put into place, and that's why you see those statistics. If we had, and if the Auditor General had focused only on June, the end of her report, she would have found, I'm not sure which statistic, but she would have found a very significant statistic, because by then, obviously too late for the early period, but by then a proper automated system was in place until the system was completely abandoned because all of these hotels were closed in the summer of 2021.
But the quarantine hotel is back for those who are coming from certain African countries, correct?
Yeah, well, has
that system been reformed?
These are called designated quarantine facilities. So designated quarantine facilities, these are a very special type of hotels. If you go to one, you'll see immediately why. These are hotels for people for whom we need to have proper medical procedures because they might be positive to COVID-19 positive, or we don't know because we haven't yet found out their test result. They come, for instance, from the 10 countries identified. So they're not there for quarantining, waiting until the test result. They're there because we need to look after them because we're not really certain of their true health status. So this is a very small number of rooms, about 2,000 rooms in, as you said, designated quarantine facilities that are still in operation. But the government authorized accommodation where people would, almost everyone coming from outside of Canada would go during the first half of 2021. These hotels have closed.
Operator, next question. Prochaine question.
Thank you. Merci. Our next question. La prochaine question. Peter Midham, Country Life in BC. Your line is open. À vous la parole.
Merci. Thanks. Question for Minister Qualtrough. Noticed that one of the reports cites the Migrant Worker Support Program that builds on a pilot in British Columbia, and I know the province here has mentioned that inspections and housing requirements for foreign workers here in British Columbia had set the pace for some of the national changes being contemplated. I was just wondering if you can speak directly to the contribution British Columbia standards and maybe standards in other provinces are making to the national standard?
Well, thank you, Peter, for the question. So we had a migrant support worker organization pilot in BC, which showed very clearly the benefit of having local organizations provide welcoming wraparound support to migrant workers as they arrived in Canada, both to situate them within the community, but also to provide vital information around their rights and the support that they could have access to. We are now taking that model across the country and are funding organizations to do similar work within communities across the country. What we've also heard in BC is, well, we've heard it across Canada, but BC is a little further advanced than some of the other provinces in their development of a more rigorous housing or accommodation standard. So housing and accommodation are the purview of provincial governments. And so the way the temporary foreign worker program works is it is the province or the local authority that does the housing inspection. We then rely on that housing inspection to move forward with the temporary foreign worker program with allotment of workers, et cetera. But we all know, and we've heard very loudly, that because of the disparity in the standards across the country, workers are not living in dignified conditions. What we put in place almost a year ago was a consultation process to really dig in with provinces, and I met with my provincial counterparts. And you'll note that this was during the pandemic, so it was quite extraordinary to understand that we had to make this massive policy shift. And we put in place a consultation and released the What We Heard report last week. But drawing on best practices across the country, we are going to work with provinces and territories and set a minimum standard for housing that goes way beyond some of the standards that some provinces have in place. And it's going to challenge provinces who need these workers, but who also need to have standards in place to make sure that they live in healthy and safe work housing environments.
Thank you.
Okay, operator, can you tell me how many people are still in the queue?
We have one last question.
Okay, if we can have the one last question.
Certainly. Please go ahead. Asa Patel from the Toronto Star. Your line is open. À vous la parole.
Hi, my question is for Minister Duclos. The Auditor General said today that she's concerned that whether PHAC is able to prove whether or not these border measures are actually effective border measures. Are you still standing by the border control measures that you have in place right now, even if we might not have a clear picture of how well they're working?
Yes, and I'll give you one reason that we just heard about this morning. In the UK, and I've had conversations with the minister, the UK health minister said that they expect over the next month to have 1 million cases of Omicron. Now, 1 million cases of Omicron in Canada is the equivalent of 20,000 new Omicron cases per day. That's more than twice the largest number of new cases we've ever seen in COVID-19. And given the stretch, the stress that we feel in our healthcare system, given the Christmas period that is coming, the fact that people will spend more time inside and meet each other more often, we need to be extremely vigilant. And we stand by that. We know it's difficult for everyone, but these measures are absolutely essential.
And will the findings from today's report lead to any changes in the travel restrictions and rules in place right now? Not necessarily the administration and enforcement, but just the actual rules themselves.
Well, the rules are the rules, so they must be followed by whoever is entering into Canada, whether that person goes to a rural area then or to an urban area. So the administration is obviously going to matter, but we'll make everything that needs to be done to make the lives of travelers as easy as possible. But with this being said, our first objective is to protect the health of Canadians. And as I said at the start, Canadians that choose to travel should expect that when they come back to Canada, there will be likely more delays, more trouble, more hassle. And that's true not only when they enter back into Canada, but as I've just said, in places like the UK, no one should be surprised that rules to travel in the UK or out of the UK or within the UK, just to give an example, may change very quickly with the type of news that we heard this morning from the UK, what we also hear from Denmark, from Sweden, just again this morning. This should be sending I think, signals, ringing bells to many Canadians who would otherwise have thought of traveling in the Christmas period.
Okay. Thank you very much, ministers, for taking our questions. And this ends this press conference.